Hello and welcome to my revision guide on challenges to a person-centred approach in health and social care. My name is Angela Kemp and I'm studying Level 3 Health and Social Care on the nursing and midwifery pathway. This video will be useful to individuals both on the nursing and the education pathway, as there is normally a compulsory 60-credit exam at the end of the unit. The person-centred approach uses a holistic approach and sees the service user as a whole individual, recognising that they'll have individual needs, wants, goals and aspirations. It puts great emphasis on ensuring that the individual is at the centre of their own care, reinforcing the statement, "No decision about me without me," therefore working in partnership with the individual. However, practitioners may face some challenges to applying the person-centred approach in their everyday practice. To begin with, both practitioners and service users may be resistant to change. Service users may not want to lose the safety net of another individual making decisions on their behalf. This could be because they are scared of making mistakes or believe that a practitioner could make more beneficial, informed decisions for them. As well as this, practitioners may feel a loss of power, especially if a service user makes decisions that are not in their best interests. This could discourage individuals from wanting to use the person-centred approach, as it could make them uncomfortable or create a feeling of loss. It used to be normal for practitioners to make decisions for an individual without their input or fully considering their thoughts, feelings, or viewpoint. This may make it difficult for older practitioners or service users to adopt this new holistic approach, as they traditionally may have assumed the practitioner knew best and let them make the decision for them. This attitude cannot be changed overnight, therefore making it challenging to adopt a person-centred approach into care. Some institutions may promote the medical model of health, which sees an individual's disability as a problem that needs curing and that the individual is limited and defined by their condition. This means practitioners may be less likely to give service users personalised support that enables them to live a fulfilling and high-quality life, and instead only give medical treatment instead of services to help them live independently. The idea of a person-centred approach is a relatively very new concept, meaning some staff may not have the relevant training on how to implement the approach into their care. This means that the person-centred approach may not be implemented effectively until all health and social care staff receive comprehensive training on how to do so. Communication barriers may be caused for a range of reasons. It could be caused by language barriers or simply a poor lack of communication between the practitioner, service users, and others involved in their care. Communication barriers may mean that the correct information is not always relayed, and therefore ways of personalised care for the individual are not identified. This prevents services from being personalised, and these barriers can lead to significant resentment, misunderstanding, and impact significantly on the quality of care delivered to the individual. It is an individual's right to refuse treatment, even if the treatment may be beneficial to them. It is also their right to choose and use treatments that may not promote recovery, as well as some other alternatives. As a practitioner, this decision can be very difficult to accept, especially if they believe that the service user's decision will impact negatively on their health and well-being. This can make it difficult for a practitioner to comfortably adopt a person-centred approach, especially if they believe doing so will lead to harm. Quite similarly to the challenges that a medical model of health can cause, focusing on deficits rather than capacities can limit the positive impacts of a person-centred approach. Traditionally, practitioners would identify what an individual was not able to do instead of what they can do. This attitude can sometimes appear in modern health and social care services. This lack of focus on what an individual can do can prevent practitioners from identifying the service user's individual strengths and from providing them with high-quality care, services, and treatments that can lead to a more fulfilling life. It is important that every individual knows their role in fostering a person-centred approach in order to ensure that the individual receives personalised care. Everyone being aware of their roles and responsibilities ensures they are able to provide the most effective and relevant information, guidance, or care to the individual. If anyone involved in their care is unsure of how to deliver care that's personalised to the individual, it means it is less likely to happen. This leads to a reduction in personalised services and ultimately a lower quality of life for the individual. And that is every challenge to adopting a person-centred approach that you need to know for your exam. Thanks for watching.